Clark County Community Services mission is to work to create a thriving community where people are valued and have the resources they need to flourish. Recently, we spoke with
What is
Vanessa
our
Gaston,
priorities, and then what are
Director
our
of Clark
outcomes
County
that we need
Community
to achieve?
Services, to hear how the creation of a new strategic plan will assist with this effort.
Hello, I'm Jim Demon with Clark County Close-Up. Thank you so much for meeting with us today.
Thank you for inviting me.
What is the role of community services?
Clark County Community Services, we're one of the departments within county government. Our main role is to kind of manage federal, state, and local funding, contracts and grants, to do a lot of different type of social services. We do a lot of varieties from behavioral health to low-income veterans, to housing homeless, to developmental disabilities. But we are kind of that social service arm for the county.
So how do you work with these funding partners to expand, enhance services?
We're probably one of the larger funders in the community around the programs that we're responsible for. So we partner with, whether it's the Community Foundation of Southwest Washington or the city or the Vancouver Housing Authority, state and federal government. We actually use the dollars to leverage to create systems to provide different type of safety net services for people that are vulnerable and low income in our community.
Okay. So now, I noticed that your department is updating a strategic plan.
Yes.
So what is the purpose of the plan? It seems kind of silly to ask, but what is the plan? When was it last updated? And then how long will this new plan run?
The last plan that we did was from 2017 to 2022, and we are required by one of our state agency funders to update it every 5 years. So we're a little bit behind because of the pandemic, but we do it because we need to actually determine what is the need in the community. So we want to hear directly from people using the services, the nonprofit providers, so that we can understand where to prioritize our efforts, where are the greatest needs, and this strategic plan helps set that roadmap for us. And so it is a living document. It is not something that we do and put on a shelf, and it's meant to be fluid. And so it really is to help us understand in the next 5 years, where should we put our focus around the priorities based on the needs in the community.
Okay. So where are we in the process of creating the plan?
So because we are a bit behind, we have gathered the data from the needs assessment, and we've analyzed that. We hired a consultant to actually kind of help us to do practice using an equity lens. So going out, doing some outreach, trying to reach diverse communities, understanding what the data says, and trying to get that feedback from staff, from the nonprofit providers, from our advisory board members, anyone that would kind of work directly with our department, and try to help us understand, to get that information and put a plan in place so that we can actually be able to understand what is our priorities and then what are our outcomes that we need to achieve.
Okay. And any estimate on when you anticipate the plan to be finalized?
Well, we do need to have it done by December of 2023. So.
Okay. And as you mentioned, community has changed a lot, growing diversity, changing demographics, so you're doing quite a bit of additional outreach to reach those communities?
Absolutely. You know, we really are using the information from our last census, but we also are kind of learning from our nonprofit providers as to what they're seeing as far as, new populations coming in. We're doing our own outreach and trying to understand kind of like, who's coming in our community, what are they saying they need. We use our data to understand which populations have the greatest struggles. And so, because of that, we are getting more diverse. I started here 15 and a half years, and so we are definitely a different community from when I started. And it's important for us to understand like who are where people are at in all through Clark County, because we serve all the county, but also where are their greatest struggles and where do we need to target our resources. And so yes, we have been increasing our outreach, quite a bit. We need to improve and do some more, and that is part of what our strategic plan will do.
Now, how can the public get involved in this process?
I would say one is definitely if you're interested in learning more, we have advisory boards, and those are public, so definitely you can tune in to listening to what those issues are. We have 6 of them. We also do quite a bit of reports. So if people want to know kind of how our programs are doing, we're working with the county to put them more visible on the website. If you're interested in actually getting involved, please, when openings open up for advisory boards, please apply to participate and be on the advisory boards. Each one of the advisory boards have different roles, but they are very actively engaged in helping our department and the county council kind of determine what to do in the different program areas.
Okay, next topic. How does your department assist with finding affordable housing for the unhoused?
Our role is, because we don't do direct services, we're a funder. And so we have two things that we kind of set our attention to. One is actually working with different developers who focus in on developing housing for lower income populations. And we will put in funding so that they can actually be competitive and get other types of funding. So that's one role. The other role is a lot of the different type of housing is needing services connected. And so we will also fund or look for those partners that are interested in actually partnering to have services connected to that housing. And so a lot of times we're part of the planning, the facilitation, bringing the partners together, as well as funding. And so that has kind of been our role around how do we actually increase capacity for affordable housing for low income populations throughout the county.
Okay, and then also with the homelessness, behavioral health issues are obviously a big concern. How do you try to assist that population?
So that is a priority for the county council and for myself. And one of the things that we have been working on for the last probably 5 years is really targeting some specific strategies for that particular population. So one of them is increasing permanent supportive housing, which is geared, and it's a program and also a policy that the state has really put a lot of attention to and some funding towards. And really it's permanent housing for people who have multiple different type of issues around disabilities. It could be medical, but it really does focus on behavioral health. And it's services connected. And so you don't just do a soft referral. A lot of times services are on site. And then you have service providers who help manage those populations so that they can stay in that housing. And we've actually worked with the Housing Authority and other nonprofit developers to really build quite a bit of units in our community. So that's been a strategy. We have a couple pilots right now that we are looking at. One is looking at how do you look at peer-related models and have them on site at these different housings, whether it's scattered or units that are connected together, to actually kind of help people problem solve, after hours, on the weekends, to really help them try to engage, stay in recovery, want to get into treatment and services. And then the other one is we're looking at how do we improve care coordination from the time someone's on the street with behavioral health issues till they get into housing and that they stay into housing. And we really want to be able to use a care coordination model that somebody actually follows them from beginning to the end. They're not a whole bunch of handoffs. People don't fall through the cracks. And we can really try to capture the data around what is the need and what's working and not working, so we can learn how to improve the system for that. So that pilot is working with Columbia River Mental Health. Okay. And that pilot has started this year. And is working very closely with Council for the Homeless and all of our other outreach teams and our behavioral health providers to really look around at how do we really do some good integrated, coordinated care, wrap some services around that population. So I'm excited about that because I think we can really learn a lot about what works and what doesn't work.
Mm-hmm. What about those, what about housing for those in need of recovery?
So, we have actually worked with some behavioral health providers who've actually went out and bought properties. And for people that are either coming out of inpatient or intensive outpatient, they have provided some housing for them. Now, that's not that's not a lot. We actually know we need to increase that. But we also have the Access to Recovery program, which is a funding that helps people who are in recovery. We do a lot of rental assistance with that. So there's a lot of Oxford housing in our community. We also help any kind of support services so that they will stay and remain in recovery. So we have that program as well. So, we know this is an area we want to make sure we have some attention. It will be in our strategic plan. But the work that we have already done, we've had some great success.
Great. One positive of the pandemic was kind of an influx of COVID funding. How has your department been utilizing these extra dollars?
Wow. I'm very grateful that we got quite a bit from the federal and state government. We got over $86 million in our community since March of 2020. And it has been truly resources that were needed, not just to help people that were unhoused, but people that lost their jobs. And so the bulk of that money was spent on rental assistance. And so, we're still spending it down. We have until 2026 to go through the money. Right now, the county also gave us $15.5 million additional money from the funding that they received. And we're using that to expand services in for the homeless system as well. Shelter, outreach teams. So we're grateful, but it was a heavy lift.
Well, and really with the rental assistance, people don't, because you don't see homeless people on the street, they don't realize, well, there could be a lot more. But it's
Absolutely.
rental assistance.
We
makes a
are,
big
with
difference.
that, we have helped over 7,000 households
Wow.
remain in housing. And so I really would hope the public would know that is 7,000 households that would be homeless if they did not get that rental assistance.
Wow, that's amazing. Okay, if people want to connect with community services to talk about some of these issues, where can they check?
I would say go to the county website. We have our own website page, and so the county website is www.clark.wa.gov. Go to department and look for community services. We have our own webpage with a variety of different reports about our advisory boards and minutes, about our programs. There's even a link if people need help with finding resources. All of that's there. They can also call our main number, our reception number, which is 564-397-2130. They can leave a message. Somebody will get back with them. But we really are trying to update our webpage so it could be more user-friendly and people can find the information they need.
Well, thank you so much. Enjoy your summer.
Thank you. Thank you.